All right, hello everyone. My name is Daniel Traverzo. I'm a third-year medical student at the University of Wisconsin School of Medicine and Public Health. Going to be going over a presentation about the importance of wild child visits. So thanks for everyone to taking the time to listen to this presentation. It should take approximately 15 to 20 minutes if I had to guess. So we'll go ahead and get started. So objectives, we're going to learn about the importance of scheduling and attending well child visits, learning about what the visits consist of, about developmental milestones, vaccine scheduling, and learning about some barriers to access. No major disclaimers, just I'm doing this all in one take, so if there's any mistakes, just disregard those. Okay, so what are well child visits? They're scheduled visits with a pediatrician or family med physicians from soon after birth and continue until 18 years old. Um, they're preventative healthcare scheduling used for general pediatric health assessment, early disease detection, and prompt management. They typically start right after birth, usually within the first day or two while they're still in the hospital. And then during their first year of life, they'll typically be seen in an outpatient setting, aka the well child visit, be at like week 2 of life, 1 month, 2 months, 4 months, 6 months, at 1 year, and then continuing on to 15-month, 18-month, 2 year, and then the 30-month, and then between ages 2 and 10 years, they'll typically be seen on an annual basis. So during those earlier months of life, development occurs at a more rapid pace. Therefore, visits are more frequent. So the contents of a wild child visit: visits typically begin with objective data collection. So height, weight, head circumference, vital signs, BMI, and then some of this data will be graphed comparatively to other children at that age in percentiles. And this will also look at the trend of development. So if you look on the right side, you can see these lines. So let's say, let's see if this works. Okay, see the red mark there? That might be plotted there. Then there at their next visit, there at their next visit, and so on. So they'll keep getting plotted, and you can see their trend as they go up, and you could see where they would be in the percentile. So this child might be in the 25th percentile or something like that. And then other things that happen at a well child visit: history, or so any past medical history, things that have happened since the last visit, and then new concerns that they want to discuss with the physician. And then developmental milestones, which we'll touch more on these later. And then, of course, the physical exam. So depending on the age, screening tests will be performed. So physical exam, one of the first things that they look for are resolution of primitive reflexes, so reflexes that infants are born with. And these are some of these reflexes should go away as time goes on. Blood pressure measurement, routinely screened after 3 years of age at each well child exam. Abdominal exam, looking for palpable masses. Heart exam, looking for murmurs, rate and rhythm disturbances. Looking at the spine. So if once the child's able to stand, they'll assess for scoliosis or curvature of the spine. And then evaluation of the hips. In neonates, there's some common birth things. It's called developmental dysplasia of the hip, which is where the hip sockets don't exactly line up right away, and that's pretty common in newborns. So that's something that's checked out a lot. Genital exam. And then let's see, screening for visual development and acuity, looking for things in eyesight, color blindness, and then screening for hearing loss as well. And that can mean anything from congenital things, history of meningitis, head trauma, ear infections, congenital infections that they may have acquired while they're in utero. Um, and then looking for hearing loss, which can cause speech, language, or social delay. Sometimes it might be mistaken for neurodevelopmental disorder, especially communication disorders. Okay, anticipatory guidance. Um, so this is where you're kind of going over with the child and the parent, just kind of like what their lifestyle is like and things that they can do to optimize safety and well-being. So starting off with child safety. So children under 13 years of age are required by law to ride in the back seat, in an age appropriate and weight appropriate safety seat or booster. Supervised play from ages 3 to 5, continuous supervision during play is necessary. From ages 6 to 8, supervision during play is necessary near bodies of water or during risky activities like climbing. Abuse prevention. Children should continuously be taught age appropriate safety as of the age of 3 years. Road traffic safety, wearing protective gear while engaging in activities with increased risk of injury like cycling or skateboarding. So always wearing a helmet, wearing knee pads or elbow pads when appropriate. Children should be taught safe street habits like how to safely cross the road. Water safety is a big one. Children just shouldn't be left unattended whatsoever near bodies of water. It only takes 1-inch depth to have a child drown. And then they should be taught how to swim early to reduce the risk of drowning. And then, of course, household safety things. So keeping harmful household products and tools out of reach from the children. Fire alarms should be installed and fire escape plans implemented, and children should be well aware of these. And then firearms should be locked and out of reach of children, unloaded with ammunition stored separately or just out of the house altogether. Then next is sleep. So from ages 3 to 5 years, 10 to 13 hours of sleep is recommended, including naps. And then from 6 to 12 years old, children should sleep between 9 and 12 hours. Daytime naps should not be forced. Media consumption, sedentary screen time for 2 to 5-year-old children should not exceed more than an hour a day. At the bottom there, you see the 5-2-1-0 rule. Screen time is implemented in that, so we'll get to that on the next slide. Cognitive and social development, teaching appropriate behavior and language, parental guidance on preventing behavioral problems such as temper tantrums, aggressive behavior, school problems, techniques to reinforce good behavior and avoid unrealistic expectations, and then health, personal hygiene, such as hand washing after using the toilet, after sneezing, coughing, and before handling food, not sharing hairbrushes or combs, oral hygiene, immunization schedules, including immunizations for travel, proper nutrition, so providing healthy foods, limiting sugary drinks and foods, physical development, encouraging at least 60 minutes of physical activity, and then education on oral development, which includes providing information about dental development and conditions such as teething, and then dental malocclusion, dental care, and cavities should also, or prevention should be taught about as well. So brushing your teeth twice a day with fluoridated toothpaste and flossing once a day. So then next is the 5-2-1-0 rule. So this is something that's, if you go to a pediatrician's clinic, you'll probably see this in all of them. So the 5 stands for 5 or more servings of fruit and vegetables per day. Fruits and vegetables contain many nutrients that a child's body needs, and they should take the place of high-calorie foods from a child's daily food menu. Children who eat 5 or more servings of fruit and vegetables a day are significantly less likely to become overweight or develop obesity than children who eat less than 3 servings per day. In addition, high fruit and vegetable consumption decreases risk of cancer, diabetes, and heart disease. Ensuring that your child eats fruits and vegetables at every meal and as a snack. And this, I think, honestly, it should go for everyone. And then 2 stands for 2 hours of screen time or less per day. Children who watch more than 2 hours of screen time, this could be TV, computer, video games, um, iPads, cell phones. Who watch more than 2 hours of screen time per day have double the incidence of obesity when compared to children who watch less than 1 hour per day. Limiting screen time to 2 hours or less per day and keeping children physically active. Children should not be allowed to watch TV before 2 years of age, and there should be no TV in a child's bedroom, no matter what the child's age. The 1 stands for one or more hours of physical activity per day. There is significant improvement in both physical and mental health when children and teenagers obtain their required 60 minutes of physical activity per day. Encourage your child to be active. Have a goal of 60 minutes a day of moderate physical activity, such as playing outdoors or biking. And then 0 stands for zero sugary sweetened beverages per day. An easy way to help is to reduce consumption of sugar sweetened beverages such as soft drinks, fruit drinks, punches, flavored milks, sports drinks, and flavored coffees. These beverages are liquid candy and should rarely be served. 100% pure fruit juice does not contain added sugar, but may well contribute to excess weight gain, and portions should be limited. Provide your child with plain milk and water to drink. Give your child fresh fruit instead of juice. Pack water or milk in your child's school lunch instead of a juice box. Okay, so next up, we're going to talk about developmental milestones, which is one of the major things you'll talk about at the well child visits. So there's 4 main categories. It's gross motor, fine motor, language, and social/cognitive development. The combination of surveillance and screening for developmental behavioral problems in children increases early identification, enabling earlier intervention, which is associated with improved outcomes. National survey data in the U.S. suggests that the combination of surveillance and screening is associated with increased receipt of early intervention services compared with surveillance or screening alone. The response to developmental behavioral interventions is greatest in early childhood. Children who are identified after school entry miss the opportunity to participate in early developmental or early childhood services. Children with undetected developmental delays are at increased risk for social and emotional problems, early school problems, and school failure. So when someone is asking you, why do I have to keep coming to these well child visits? There's so many of them, every couple of weeks or something like that. This is probably one of the most important things, why they're so frequent at an early age, because of that rapid development. It's really key to catch if a child is behind on any of these categories of development, so that they can catch those milestones and then get the appropriate intervention for that child, so that they can keep up with their peers and not fall behind unnecessarily. So here's some examples of developmental milestones within the first year. So at 2 months, the baby should be able to raise their head and chest, which is the gross motor. They should be able to recognize mother's voice and have a social smile. At 4 months, they shake their rattle, holds their head up, rolls from front to back, and they laugh. At 6 months, sits without support, transfers objects from hand to hand, stranger anxiety, and they babble. And then at 9 months, they start crawling, they get separation anxiety, they have bisyllable babbling, and they can use a pincer grasp. And then at 12 months, they start to walk. They point at objects, they know 1 to 5 words, and they follow simple commands. And then here's a chart for 1.5 years to 5 years. I'm not going to go over it, but if you want to read it, feel free to pause the video. But otherwise, we'll go ahead and continue on to vaccine scheduling. So immunization is one of the most effective Preventative health measures. The number of cases of most vaccine preventable illnesses in the United States declined by more than 90% after routine childhood immunizations were introduced. Vaccination programs directly benefit the immunized child. They also indirectly benefit unimmunized persons through the community, aka herd immunity. Community or herd immunity occurs when the portion of the population that is immune to the infection is large enough to decrease the risk of transmission. Herd immunity protects children who are too young for immunization and people with contraindications to vaccines. It relies on the majority of the population receiving routinely recommended immunizations. So next slide. This is the schedule for vaccination between birth and 16 years old. So if you want to pause this and take a look at it, feel free to. Otherwise, we'll go ahead and continue. So next up, barriers to care. So 3 things that I thought would be major barriers would be transportation, finances, and time. So I had a couple of quotes, or I found a couple of quotes regarding these 3 different barriers to care. So for transportation, someone said I had to miss a well child visit because of transportation. Me and my fiance only had 1 car, and he had to use it for work. So, and I just did not want to take the bus to get there, or it cost too much to get a cab from where we lived. And then for finances, someone said I just have to pay to park, and sometimes I have to scrape up money to park because of the situation, and because I'm not a wealthy individual. Another person said one day I had to borrow money from the parking attendant to get my car out of the lot because I didn't have the money. Someone else said they're overworked, underpaid, and not enough money to pay your bills, worry about food and your kids, and just everything in general. And then someone else said I'm on a fixed income and the child support is not enough, and I'm trying to make sure we have food stamps. And then for time, someone said I've actually had to reschedule some of her appointments just because they won't allow me to take off to come take her. And I think that's where a lot of people in your position come in, are to help navigate these barriers to care, because I'm sure that these are extremely prevalent in any community. So yeah, it's good that we have people like you to help them navigate the complex health system that we got. So, in summary, why are well child visits important to schedule and attend? So, number 1, tracking growth. At each well child visit, your pediatrician will record your child's height and weight. For infants, these measurements will also include the circumference of the baby's head. Comparing these measurements to those of the last visit, as well as to the growth charts for children of the same age, allows your doctor to track your child's growth. When it comes to the growth chart, the important thing isn't necessarily a percentile itself, but rather the rate of growth. This can point out growth deficiencies in things like malnutrition. Number 2, monitoring development. So talking about developmental milestones will likely be the most common topic discussed at your child's well child visit, especially in the early years. This can include physical traits, social behaviors, and emotional health. Regular visits, even when your child is not sick, will establish trends that can help your pediatrician spot and address irregularities or concerns in a timely manner. Number 3, child health education. Your pediatrician can help educate your child on the importance of a healthy lifestyle to prevent future medical conditions caused by poor health habits and equip you as a parent with educational resources and tools that are needed to support them in these areas at home. These can include discussions about diet. So proper nutrition is key for growing children. Your doctor will ask about any allergies, aversions, and how to ensure picky eaters get the nutrients they need. Talk about exercise. So kids need an hour of physical activity every day. Your pediatrician will offer suggestions on how to get less active kids moving more. Injury prevention. If your child is already active, your doctor can help mitigate injury risk. Many schools also require a sports physical before the season starts. Be sure to ask if your well visit counts for that, or if you need a separate appointment. Sleep habits. Children 6 to 12 years of age should sleep 9 to 12 hours per 24 hours on a regular basis to promote optimal health. Teens ages 13 to 18 need slightly less sleep, 8 to 10 hours. If your child isn't getting enough sleep or is sleeping too much, your doctor can help identify the cause. Number 4, preventative care. New studies, equipment, medication, and health care guidelines for children can change over time as physicians and researchers learn more. Following the recommended well-child visit schedule will ensure you to stay up to date on all preventative treatments available to your children, such as immunizations and screenings. And then lastly, developing a patient-provider relationship, so establishing a team approach to the child's health. So regular visits create strong, trustworthy relationships among pediatricians, their patients, and the patient's parents. In order for them to be an effective partner in the care of the child, the parent and the child both need to build a relationship with their pediatrician. The American Academy of Pediatrics recommends well-child visits as a way for pediatricians and parents to serve the needs of the children. This team approach will help the child's provider gain a better understanding of the child's medical history and can help you navigate through various life experiences. So here's my references. With that, we're at about 21 and a half minutes. So thanks again for listening to the presentation. If you have any further questions, I'd be more than happy to answer them. Feel free to just email Danielle, and then she will get me in contact with any of you. All right, well, have a great day, everyone.